I'm Anitha Tingira, a PhD student at the Institute of Social and Cultural Anthropology at the Freie University of Berlin, and I'm researching on provision and uptake of maternity services in rural areas of Tanzania. Maternal mortality is a problem in developing countries, and one of the ways that was proposed to reduce maternal mortality was to increase the availability of healthy services, especially in rural areas. Now, Tanzania has a really wide network of rural healthy services, but the paradox is maternal mortality has not shown any significant decrease. So the question remains, why? There is a problem there that experiences of women, especially in developing countries, are conceived as the same. So if family planning works in Tanzania, it should work in the same way in Kenya, in Uganda, and even in India or somewhere else in Asia. Yes, women die. Yes, there are similarities, but what about the differences? So what I'm trying to see is how women engage with these interventions within the global historical, political, social, and economic processes as they are in specific contexts. If you look at the statistics right now, 300,000 women die each day across the world from maternal-related complications. So I feel it's like a moral obligation to understand what can really improve the situation. You see, okay, a lot has been done, but you cannot just sit back and say it's enough. I remember one day I walked into a village dispensary. A healthcare provider was attending women, and I knew one of the women who was waiting for the services. And when the turn came for the woman, she was pregnant, almost 30, and it was her fifth, and the health care provider was like, okay, you have given birth to enough number of children now. You should consider using family planning. You shouldn't continue giving birth. It's not good for your health. And you know all that talk about family planning. You can educate a few children. You can send them to good schools. It doesn't do you any good to have many children. And I was really interested with the talk. And because I knew the woman, when she was attended, I walked with her away from the dispensary, and on the way we were chatting, and I asked her, okay, after you give birth, what kind of family planning method do you plan to use? And she told me, no, I won't use when I give birth, but until I have like 2 more children, then I will start using family planning. As we talked, I came to realize the way she sees the world and the way the healthcare provider sees the world are 2 different things. For the healthcare provider, she was worried, okay, she will die from a maternal death. She won't be able to educate children. But her view emanated from a more complex perspective. Okay, she was concerned about her image as a woman. Being able to give birth to many children was important to her community. And also, she feared the effect family planning can have on her fertility. But again, having many children was a way of making sense of the changing world, the economic situation, the moral situation. And she told me, you can educate a child, but you're not sure if she'll get a job. And she went on to give me examples of children, of the people she knows who were sent to a school, completed high school, some went even to the college, and they were back at the village with nothing to do. So giving birth to many children to her was about taking control of the future. So they were both trying to look at the future. The healthcare provider was looking at the future, and the woman was looking at the future, but both from 2 different perspectives. So when we look at the world and try to simplify the complex situation, we'll never see the world for what it is. And I think that's where all problems begin. You try to simplify the complex situations. It's really sad when you think that these deaths can be prevented. They can be prevented. 90% of these deaths are actually avoidable. So what we really need are proper interventions in place in order to avoid these deaths.